Hello viewers and my dear students. Welcome you all in today's live class. I am Divya Pandey from IGSCON and I am here to welcome you all in today's live class on topic quality assurance in medicine. Before going ahead with our topic, I would like to request each of you to like, share and subscribe our YouTube channel rgcsk.edu for upcoming live classes as more interesting topics for both nursing and paramedical courses. So here we'll start with our topic, that is quality assurance in medicine, raising the standard of care. So this is important topic as a subject of nursing management. Why we need to focus on the quality assurance, because we are the provider and our patients are the customer, what they are receiving as a care. So there should be a quality and the patient should have the assurity that they had been receiving the good quality of care. So by this we can as a nursing professional we can enhance the standard of our nursing profession by providing a quality of care. So there should be some standards, some criteria or rule or regulations should be there in a hospital while providing the care to the patient. So the patient should be satisfactory. So on this topic we will going to deal in a full detail. So first, we'll see introduction. The expense of quality is an interactive process between the customer and provider. Quality assurance typically focus on the materials, good works, and the services provided effectively. Any lack in the services provided results in the decrease in a quality. So, like what care we are going to provide as a providers and what care they are going to receive patient as a customer, because they are paying for us. We are getting paid to care for them. So we need to care at a standard level so the result can be in a positive way. They can give us the positive feedback. If we are not achieving that result in a positive way, so we need to work on those standards to enhance the quality of our nursing care. So now we'll see what is quality. It is a degree to which health services for the individuals and population increase the likelihood of desired health outcomes and are consistent with the current professional knowledge. Joint Commission on Accreditation of the Healthcare Organization 2002 had been given this definition on quality. Quality means at the higher standards, how we are providing care to the population, those who are coming to our hospitals, our institutions, how we have been managed, how the admission process is there, then how we are dealing with the patient, what criteria is there, in which criteria or category we are keeping the patient, those who are very sick or in a normal patient or those who need only less care. So how we are categorizing them and how we are providing the care, that is known as the quality. So first of all, our motto should be we should work on the quality rather than quantity. We should always focus on the quality of care, or anything is there, then we need to select the quality among that. Next is assurance. Assurance, it is a statement or indication that inspires confidence. Assurance, like anyone is having trust on you. There should be assurity, like 100%. I know if I'll visit to this hospital, I'll get the good quality of care. So the patient or the consumer should have the assurance in this institution or this organization or the nursing as a professionals, they are providing a good quality of care. So it is combinedly known as quality assurance. Quality assurance definition we can see. Quality assurance is an ongoing, systematic, and comprehensive evaluation of the healthcare services. Their impact on the health outcome was given by COSIR. Quality assurance is defined as all the activities undertaken to predict and prevent the poor quality, that is NITWIDS. So these are the definition. In this, it is showing it is a continued and systematic, well-planned process of evaluation. Like if a patient is coming, then nurses are providing the care. The higher authorities will be evaluating the nurses. There will be a feedback form. There will be a regular assessment of the patient. The doctors will visit and see what quality of care they are providing, whether their medicines are effective or not, what basic cares whether they are getting or not, and these medicines and the basic cares are relatable with their progress or not. So there will be meetings, there will be assessment, and each of the professionals will get undergo through the evaluation process. In this, they will see whether what we have been planned, whether it's being achieved or not. If it is not being achieved, then again we have to do the re-evaluation. We need to work on that in a same process, like it will be a cyclic process, ongoing process that will be there. And it will be working and seeing evaluation of the all the activities what a health professional are doing to make the standard of the nursing or any health care at the top. So there will be higher authorities will be continuously watching this process. Next, we'll see a definition of a nursing, because it's going to deal with all the hospitals and our nursing setup. So we need to know about the nursing as a basics. The unique function of a nurse is to assist the individual sick or well in the performance of those activities contributing to health or its recovery, or to a peaceful death that they would perform unaided if they had the necessary strength, will, or knowledgeable. The nurse does this in a such way as to help the individual gain independence as rapidly as possible, was given by Virginia Henderson. This nursing definition was given by Virginia Henderson, and according to this, nurse is the one from the birth of the child till the death of the person. The nursing care has to be there, and nurse is not only while the person is sick you have to care. When they are not sick, they are well, but they need emotional support. That time also nurses are needed. While spiritual care, that time also nurses are needed. So it is like a overall wholesome care or activities provided by a nurse, and that is known as a nursing profession. What are the objectives of quality assurance? Why we are going to study about, or why we are focusing on the quality assurance? Objectives are to ensure the delivery of a quality of client care, client or patient, we can say, like whatever care we are providing, there should be a rationale, there should be a scientific reason behind that. We should not provide any care like we wanted to do, we did. If we are doing the hair washing, it should be a rationale behind why we need to maintain the personal hygiene of the patient, because patient is not capable of. So there should be an objective, like whatever care we are providing, there should be a quality. Then, to demonstrate effort of healthcare providers to provide good results. So for this process, there will be a regular in service education program will be there. So the health professionals would be taught about what are the new procedures or new things are there. So they are being taught, and practical regular basis their practices will be ongoing, so they could provide the good quality of care, or they should have skills on hand. They could be capable enough, and they should have competent enough in their skills, like providing sponge bath or providing medications, injections, IV cannula, fluid. So there should be a skill, the staff should be skillful, because of that no patient should have any harms or injuries. To formulate plan of care, to formulate like a pre-plan should be there, what we are going to do, on that only we need to work. Pre-plan will be there, like one blueprint will be there. If a patient like this is coming, what care has to be provided and how it has to be provided, which category nurses or which senior nurses or junior staff or which will be going to provide the care. So there should be a there will be a plan. Next is to evaluate the achievement of the nursing care. Evaluate the achievement, it is a result. If a patient, it depends on the patient feedback. There will be a feedback forms in a hospital or normal basis while doing the discharge. Patient by their own or the bystanders will tell their views on the hospital and the type of nursing care they had been received, or they will go outside and they will tell their known persons to whether they have to visit that hospital or not. Next, objective to appreciate importance of practicing the standard safety measures. Appreciate means standard safety measures, like while caring for the patient, what safety measures we need to take care for staff nurses or for the professional, as well as for the patients. Plan and conduct the patient teaching sessions. Patient teaching sessions like health talk will be there. So on the some basic problem or some general problem, we need to talk with the patient, or we need to educate the patient in a hospital stay. Then to identify appropriate management techniques to be used to managing the resources in the given situation. Management techniques mean the person or the health professional should have the critical thinking. What are the resources are present, with that how they are utilizing and doing the quality of care, or how they are enhancing the standard of a nursing care. Next, we'll see what is the purpose of quality assurance. It is required to introduce code of ethics and professional conduct for the nurses in India. Code of ethics and professional conduct means there will be some rule and regulation. The nurses need to be bound on that. Like for example, negligence. We need to avoid the negligence while we are working in the hospital. Negligence means we are without seeing anything, we are giving care. Sometimes without because of the professionals negligence, sometimes patient will be suffering. So these are things has to be taught to the nurses according to the standard of the Indian Nursing Council INC in India, to prepare the staff nurses for implementation quality assurance model in the nursing. Like there are some studies research, and there are some many models are there, like ANA model, PCDA model. Many models are there which can be applied to enhance the standard of nursing. So the regular uh, uh, sessions or the topic has to be taken for the professionals as well, so they should be aware about how to apply the thing and how they have to provide the quality of nursing care in the hospital. To provide the best care to the patient by maintaining the standards, with maintaining a standard and with maintaining the codes of ethics, they have to provide a higher standard of a care. Principles. First is customer focus. It focuses on the patient's care with the standard and recent medical knowledge. Like patient main focus will be the patient quality, because they are the consumers. We are going to provide the care to them. So the main focus will be our patient, our consumers, how they are feeling after receiving that nursing cares or any health care. So standard need to be maintained. Like it should be done procedure wise. It should be like safety techniques should be applied, and hygienic precautions should be taken. Everything has to be according what had been given in the books. It should be according to that, so we can maintain the standard. Next is leadership. It helps to inculcate the quality of leadership in the staff. Like with giving the works or making the members to be involved in the team, we can find out the leadership quality in the staffs. So we can make them as a group leader, or we can make them as a according to their experience and seniority and their quality to work and their way of working. We can also make like in charges and ward in charges or specific area in charges, so they can lead the group, they can manage the group, they can manage the other staff nurses as well. Like involvement of the patient, it should be involved the maximum nursing staff so that the standard can be maintained. uh, Involvement of the people means there should be a more resource persons will be there, like human resource has to be there. That's why we do have, like if this much bedded hospital is there, we should have this much number of staff nurses. So why? According to the bed, how many patients will be there, according to that the people means the staff nurses or the health professionals has to be there. So it will not come a burden on a one person or a two-person. There should be a team to deal with a one patient or a one person. Next is process approach. There should be a systematic planned approach to provide the quality care. Systematic from basic to the standard. First the patient, if it is coming, we are not directly sending the patient to the surgery. We are not sending in OT. First we need to start with the basic. Like we need to take the history of the patient, then we have to go the like vital signs, then some investigations, then medications, then at the end with the consultation everything, the surgery will come. Then the quality of care standard has to be maintained according to the process. Like we need to go with the plan only. Next is the factual approach to decision making. There should be a fact or appropriate reason in taking the certain decision for quality assurance of the patient. Like whenever we are taking any decision, there should be a rationale behind that. There should be a factual thing on, like normally we cannot take any decision. There should be involvement of the higher authorities as well as the patient bystander. If the patient is capable of taking the decision, we can also take the point of view of patient as well. So it should be taken, so we can provide a quality care, and we should provide a surety to the consumers to whom we are providing care. Next, we'll see about the approaches of the quality assurance. Method for measuring the performance. As nursing care is delivered within a framework of independent relationship with the physicians and a multiplicity of other healthcare personnel, the most commonly used method of nursing care are task analysis and quality control. Like how can we measure the performance? First of all, we as a nursing professional, we cannot directly provide the care to the patient. There will be involvement of a full team, like physicians will be there, our doctors will be there, the nurses will be there, the paramedical staffs will be there. Everyone will make a team, because a nursing work a nurse can do, but I cannot do the physician's work. Laboratory work other person has to do. So there will be involvement of a full team to care for the patient. So we need to analysis and have a quality control. Quality control, like it should be not poor. We need to enhance, or we need to maintain the standard. It should be at a higher level. Measuring actual performance, it is an ongoing repetitive process with the fact actual frequency dependent on the type of activity being measured. It is better to clarify the purpose of measurement and to measure performance on a continuous basis. Measuring of the performance, like of how hospital is working on. There will be like a ward performance can be evaluated like in a month basis, in a week basis. So first of all, there should be a reason why the evaluation or measurement has to be done, on what purpose we are doing, and what activity we need to evaluate. While it could be a patient care, it could be a inventory control, it could be a like proper rhythm of a staff, whether they are coming or not. So we need to decide on which thing we need to do the measurement. On those top things we need to clarify everything, and there will be a proper evaluation by the higher authorities or the senior nurses or senior staff. Next, performance comparison and improvement. Comparison, like it could be from the previous year to the present year, or previous month to the present month, or from one ward to the another ward. There will be a comparison. They were having this much of staff and their work is like this, and you are having this much of staff and your work is like this. So this is a comparison. After comparison, what is the result, what is the feedback, and we need to work on that, because we need to improve. So that is performance comparison and improvement. The standard and objective and the methods of measurement have been set. It performance matches the standard and objective. Managers may assume that things are under control. If the performance is a contrary of to standard and objective, action is necessary. Means what the standard had been set, what the plan had been made. After evaluation, if we had been like evaluators had been seen, or the managers had been seen, we are going according to our plan and everything as we are expecting. um, Nothing is we are not deviating from our standards and objectives what we have been set. So then it will be okay. Then the managers or the evaluators will think all the things are being in control, every the process is going well. If anything is diverting or deviating from the normal, from the standards, we are not we are not providing care according to the rationale, according to the standards, and quality is not maintained, the feedbacks are not good. So the managers or the evaluators will think we need to improve on it, and we need to again make a replan and reevaluation and reworking on it is necessary. That is a performance comparison and improvement process. Next is reinforcement, strength, and corrective action. Reinforcement means if anything is deviating, if we are reaching towards the failure, we need a reinforcement, re-energy we need in our person, like in a patient or a staff, as a student, as a teacher. We all need the reinforcement, motivation we need, and some feedbacks, what we can do improvement, what corrections we have to do, which area we need to work. So positive aspect needed to be identified in order that they may be translated into encouragement and motivation for the nursing members involvement in achieving them. Sometime like some on some specific or some big thing we are working and we are not reaching towards the positive result. So there should be, first we need to, if we are going to tell anything or any feedbacks we are going to anybody, whether these are the nursing professional, student or teacher, first we need to motivate them. We need to tell good things in the positive feedback we need to provide. Then along with that we need to tell what improvements or what corrections or what alterations they have to do. So it will be a good that can motivate or encourage them. Encouragement can be there so they can work on it again. Next one is development of quality assurance program. It is important for foster the committee of quality, so they can work well. Then conduct a primarily review of quality related activities. There should be a proper meeting, there should be a proper communication, and every person should be aware about it. What are the activities, how we have to work, what are the standards. Like if any hospital is going undergoing with the any inspection, so there will be a meetings, there will be a sessions. So the authorities will tell how you have to maintain the ward, how you have to maintain the register, how patient has to be there, how tightly you need to maintain your ward, how things has to be kept. So this has to be told to each and everyone, that then only further they can be work on their wards or their areas. Develop the purpose and vision for the quality assurance effort. Then there should be a proper vision why we have to provide a quality assurance. What we will get from the quality assurance? We are working for 24 into 7 in the hospital, we are not getting good salary, why we have to work on that? So there should be a proper vision and mission why we are doing these jobs, because we have to make the standard of our nursing. We need to enhance the seats or sorry beds in the hospital, or we need to get any accreditation, for example NABH or any, like in colleges we can see the INC inspections will be there, QCI inspections will be there, the faculty inspections will be there. Like this hospitals will also will have the inspection. So they have to maintain the standards and criteria. So these all things has to be, the knowledge has to be imparted to the health professional, whether they are nursing, whether they are physicians, to everyone that awareness has to be given. Determine level and scope of initial quality assurance activity, and the levels and the standards also need to be described to them. Assign responsibility of quality assurance. There should be a team, there should be a higher authorities, there should be managers. So there each and every individual should get a responsibility. They should be responsible for them. So only a team can be reached to the goals or the result, positive results. Next, allocate resources for quality assurance. Resources, it could be a human resources like staff, where much needed, how paid. Like in an ICU, we can see 1:1 ratio patient we need, because ICU patient will be more sick. So one nurse and one patient, they have to full take care of the patient in their on duty. In general wards, like 1:3, 1:9 patient can be there. If they are okay, like only medications and this basic care is needed, then 1:10 patient, one nurse and 10 patient is okay. So this knowledge has to be there, and according to the resource allocation need to be done. Develop a written quality assurance plan. A written quality assurance plan, like there should be a proper plan or a display plan or some systematic look. Like in a hospital, first administrator will be there, then under them who will be there, then staff nurses in charges. Like this, there should be a plan to whom we need to ask, to whom we need to go for this work, what we have to do. So there should be a plan, there should be a person, there should be a team, and responsible people should be there. Critical management system. Critical management, like some emergency situations will be there in hospital. Like in a, if we'll see the medical side, it could be a cardiac arrest will be there, some assaultant will be there, or absconded patients are there. For this thing what we are going to do, or any medical emergencies are there, so there should be a proper plan. In that also the person should be there. If like this thing is happening, then who need to be respond to the situation. So there should be involvement of a person, higher authority till the lower authority has to be there in the team. And disseminated quality assurance experience. Disseminated, like differentiation, different, like according to the standard, according to the qualifications, there should be a different responsibility has to be provided. And manage changes. Manage changes means the people or the persons should be capable enough, if any instant changes are there, they can be capable of adjusting to those changes in an organization. Approaches for quality assurance program. There are the two approaches for the quality assurance program. First is general approach, and the next one is a specific approach. So we are going to see about these two. First, we'll see about the general approach of quality assurance. It involves large governing of official bodies. Large governing of official bodies means authority bodies under whom we are working. Like for example, if we'll take for the college, UP State Medical Faculty, in a nursing college, and we do have the affiliation from the universities from with whom we are being registered. So there should be a involvement of large governing bodies, otherwise our institution or our hospital will not work, it won't be recognized. Evaluation of persons or agencies ability to meet the standard at a given time. So some time duration, like in a 3 month, in a 2 month, there will be an inspection in a hospital. So they need to maintain the standard according to their criteria. They have to fulfill all the requirement. So given time has to be given, and the evaluation of the staff, professionals, authorities, and the infrastructure, everything has to be done in this process. Credentialing, it is a process of determining and maintaining the nursing standard. Credentialing is simply like after evaluation, then specifically giving someone that yes, you are capable enough to reaching this standard. That is known as credentialing. Functional components of credentialing process. According to Hink's work, credentialing process has four functional components: to provide a quality product, to confer a unique identity, to protect provider and public, to control the profession. It will be working on four things, like quality has to be there, it has to be maintained, and it should be unique enough, like it should be different, and there should be a protection or safety of the both provider and consumer, like our public, our patient, and the health professionals, and control the profession. And we should be work on our code of ethics. There should be rule and regulation has to be maintained, like community health nurses are there, their rules, villages area or rural area, they had to visit, but the staff nurses inside the hospital, in hospital, they need to work on that. So professionalism control has to be there, along with these standards we have to maintain and reach. Okay, so next we'll see about the licensing or licensure. Individual license is a contract between the profession and the state in which professional is granted. Control over the entry into and exist from the professional and over the quality of professional practice. License, as we all know, being a nurse or any health professional, we need to get our registration. After completion of our course, we'll get the result. Then we'll get a registration from, like, if we are, like, for example, if I'm did my nursing from a UP state, so I need to get a registration from UP state. If I'm going anywhere else, I need to show that registration, that I had been did nursing from this college, and this is my authority body, UP state medical faculty, that we did and got the registration, that our RN number. Without that, we are not being, if you want to do teaching also, you are not being allowed without your registration number. If you want to go hospital also, they will ask you first, when you completed your course, how much of experience do you have, and do you have your license, means do you have your registration number, because we need to work on that. License is like, it is an confidentiality. We can tell the UP state medical faculty or any state governing body that this candidate, it is showing that they are capable of doing this and they had been completed their training. And sometime if any mishappenings will be there, or miss any, we are not working on properly, there will be cancellation of our license as well. So this is known as a license. So these are the steps we need to follow to maintain the standard of our nursing. Next is accreditation. Accreditation is the act of granting credits, recognizing especially to an educational institute that maintains the suitable standards. Means there will be ongoing systematic evaluations, or the inspections will be there. In that inspection, the governing or the authority bodies will assess what are the standards that college, that course has to be maintained, whether they are maintaining or not. It will be specifically for the educational institute. For example, there is a nursing college, in that 3 4 nurse, ANM, JNM, BSc, MSc is there, then there should be a proper faculties will be there, classrooms will be there, then all the classrooms should have the PowerPoint presentation, labs will be there, labs will have the mannequins. So they will come and see these standards and criteria, they will see. After their inspection and their evaluation and their visit, they will send us the report. In report, what criteria we did fill or not, whether we are maintaining that we are reaching towards their standards or not. If we are reaching or having those all things, we are fulfilled the criteria according to them, then we'll get the credit, and will be affiliated, or we can accredit it from that authority, like INC inspection. Then at INC we had been recognized, accredited or affiliated. Then QCI inspections will be there, UPSMF inspections will be there, university inspections will be there. So they will come and see whether according to the course they are have fulfilling the criteria or not. Next is certification. Certificate is usually a voluntary process within the profession. A person's educational achievement, experience, and performance on the examination are used to determine personal qualification for the functioning in an identified specialty area. Certificate means certifying that. For example, I had been completed GNM, then I had been given a certificate that this person is being completed this year, training of this much year, and is capable enough for doing the skills or working in the hospital area. So that is a certificate that is valid for everywhere. Whether where I have to go, I have to show that certificate before joining or anything. So that is in like certificate we used to get in our educational areas, academic areas, when we'll have the rank holders or any games or sports, like many criteria there will get the certification. Like this educational institution as well as hospital will also get a certification. For example, in a hospital, NABH hospital is, so there will be a proper inspection process will be there. There will be many months of proper evaluation. Then they will be accredited with a certificate that this is a certified hospital. Like this institution, this is a certified institution that they had been graded like a QCI and everything. This is known as certification. Then first, this was about the general approaches of quality assurance. Now we have to see the specific approaches of quality assurance. Quality assurance are the method used to evaluate and identify the instance of the provider and the client interaction. It is like internal, specific, like inside the institution or inside the hospital only. Basically, it will be the interaction or a feedback from the consumers, and it is all totally based on the interaction between the our health professionals and our consumer as a patient or a public. So first one is peer review committee. Peer review committee, like hospital staff are there, so they are the peers. If staff nurses are there, they are the peers. If doctors are there, they are the peers. Like they are working for the same thing, they are having the same qualification. For example, you can take like BSc nursing first year, there are a peer group. As a faculties, they are the peer group, so we need to do the evaluation for one other. If I am taking class, then other faculty can evaluate me. If I am doing any nursing care, another staff can evaluate me. That is known as peer review committee. These are the designed to monitor the client specific aspect of the care appropriate for the certain levels of care. The audit is used by the peer review committee to ascertain the quality of care. Audit, it is like a proper information data has to be kept from the starting till the ending, like we receive the patient in the ward, how we maintain the documentation of the patient, how we keeping the files of the patient, and how randomly we are visiting to the patient, whether they are like we are telling the physician to visit the patient or not, whether we are having a proper conversation, therapeutic communication with the patient or not, we are giving medicines on the time or not. This has to be reviewed by our peer committee. Then we'll see what is nursing audit. Nursing audit, it is an evaluation of patient care through analysis of written record maintained by nurses in a patient treatment profile according to Avatar Barak. That is, nursing audit is simply that making the data. Like we need to keep the data for the starting till the ending. Like in our hospitals also, we will keep the patient's file in record room. We like however old patient is there, at least for that 5 to 10 year of time, we need to keep those patient files in our record rooms. If patient is discharging, those all the file with the discharge paper, everything has to be go to the record room. Like that, the nursing audits will be there. Nursing audits means like all the staff will get the specific ward. In there, you will get every day your patient. In patient, like what care you had been given, there will be a like front sheet, vital sign sheet, and the intake output chart will be there. Then there will be a what nursing care you had been provided. Like sometime you had given nebulization to the patient, then you have to write nebulization had been given with this medicine at this time by this nurse, and signature has to be there. So whether these records had been maintained or not, whether inventories has been fulfilled or not, patient things has done or not, like we need to send the report to the physician. Now at present time we are using the computers in our wards. So there will be a online, there will be a patient, there will be a nurse's ID in laptop. So you need to go to our ward. You need to open your computer with your ID and send the things like patient present condition, medicines to the physician, or they can also prescribe your online medicines to the patient if they are busy or their schedule is busy. So it is all about the collecting all the information from starting till the end. Goals of nursing audit: to improve the quality of health care, to promote the improved communication among the nurses and other healthcare members. Like there will be a handling over, means like morning duty staff is going, then the evening duty staff need to get a handover, like how many patients are there, if any specific medicines we need to administer to any patient, or we need to call a doctor for this patient, or any blood sampling has to be taken, any investigations has to be done, any patient was more sick, we need to take care. That is all about handling. Like whatever happened in the morning session, we need to tell all the information to the evening session. So this documentation is very important. Like while checking the files, we can understand, yes, morning this medicines had been given. For example, if patient is recommended with the paracetamol, it is on BD like 2 times in a day. I had given morning, but I didn't mention or didn't did any charting in patient record. So the afternoon staff will come, and sometime by mistakenly they will see patient ka record, there is a to give the medicine, but morning staff, I think they had not given the medicine, so they will again give the medicine. So for patient it will be overdose. So these, for preventing these all things, the proper documentation process has to be done for the patient. To improve the quality of nursing care, to detect and analyze the problems and errors. First, we need to more focus on the quality care, and we also need to evaluate what problems is coming, what errors are coming, like some staff deficiencies is there, or negligence is being there, or they are not caring properly, or who is good at making the documents well. So these all things we need to note out. Next is nursing audit process. Here we'll see the advantages of the nursing audit. Provide quality of care. A patient is assured of good service. It will give valuable and pertinent information for the staff. It will lead to between the cooperation and communication among the nurses and healthcare team. It is not only good for the organization, but as well good for the staff nurses also. Sometimes like from our brain things are skipping, so we can go back to files or go back to documents which are being loaded or which are being written. We can check out and we can get the knowledge back. So it is very important for the staff nurses, because it will enhance the communication and there will be no confusion among the staff. It will help each other professional nurse for her self evaluation. It helps the administration as a better planning. It will reduce the incidence of medical legal complications. It will broaden and strengthen the nursing services. Medical legal problems, like some police cases are coming. For example, it can be take a rape victim cases are coming, or some accidental cases are coming. So that time it will be converted as a medical legal cases. In that we need to involve the police, the area police we need to involve, and there will be proper uh, signatures and all the things has to be written properly. Sometimes the case can come to the nursing professional or to the hospital, because of them it is happening. So we should have a proof to show how the process has been started. Then utilization review. So we need to see a little about the how research is being evaluated, involved in this. Utilization review activity are the directed towards the assuring that care actually needed and that the cost appropriate for the level of care provided. It is means like if a patient coming with a condition, we should not provide every patient same care. There should be a criteria for, like there should be a priority, there should be a criteria, and there should be what we need to provide to who need a basic care, who need a special care, or isolation ward who need, like this we should have awareness and criteria, and it is like who wanted what care, we had been provided that care or not. Next is types of utilization review. There are the three main types of utilization review: prospective, concurrent, and retrospective. Prospective means before giving a care, there will be a planning how we have to do. That is known as prospective. And concurrent means while ongoing process, we need to evaluate whether the things are going well or not. And retrospective is defined as after giving all the care, after care, what are the feedbacks and evaluation we need to do. That is the types of utilization review. Next, we will see the evaluation studies. Donabiden's structure process outcome model. Donabidens introduced three major methods of evaluating the quality of care. First is structural evaluation. This method evaluates the setting and instrument structure means at what area we are going to do this and what instruments we are using, what setting is there. So this is all about the structural evaluation. Next, we'll see about the process evaluation. This method evaluates the activity as the related standard and expectation of the healthcare provider and management of client care. Data is collected through the direct observation, review of the records, audit, etc. Means while ongoing process, how the process is working, what are the things are being involved, whether we are going through what standards we had been or what things we had been planned or not. And the last one is outcome evaluation. After all the care, after all the services, what is the outcome, whether it is going out of cost, like it is more costly, or things we did not reach our standard, or care is not properly provided. So the net changes that occurs as a result of the healthcare or net result of the healthcare, the data of this method can be collected from the vital statistics such as a record, death certificate, or the telephone client interview, mailed questions, and the client records. Like how we can, like sometimes patient will immediately discharge from the hospital. So there will be a follow. Patient will come and visit within a week of a time. So that time we can also collect this data, whether how was their stay in the hospital, whether they had been provided, they had been received the proper care or not, or while we do have the patient contact number. So with that we can have a telephonic interview with the patient for collecting that data. Next one is the model of quality assurance. First is system model. System model is used for the implementation of unit-based quality assurance program. It is involves the making changes in organizational structure and individual role in a system model. Task is broken down into manageable components based on the defined objectives. System model, it will be specifically work on the one area, like a ward wise we can take or the area wise we can take, and it will be like many models are there which will we will apply on, like we will make our plan on that model, and we'll see whether those things are going according to our plan or not. Then basic components of the system model are input, throughput, output, and feedback. Feedback, like we what we had been kept as an input, and throughput, like it is a process, and output what we get a result. And in a feedback, if standards are not being achieved, then we have to do the corrections. We need to improve, and we need to work like reworking on it. Same model has to be go through again in a cyclic form. So here we'll see NA quality assurance model. There are the many models. So NA is American Nursing Association quality assurance model. This is an cycle. So it will be start from the identifying the values. Identifying the values means we need to identify the problems of the patient, whether what problem they are facing, whether it is a medical, physical, psychological, or spiritual, what problem they are facing, for what purpose they had been came. Then identify the standard and the criteria. Then we have to plan what type of a care we have to do, or what we need to be do for this patient according to their condition, their situation or issues, what we have to do. Next is secure measurement. Secure measurements, like assessment has to be done, what type of care they needed, whether what we have been planned is it good according to them or not. Then make measurement. Secure make measurement, like proper standards has to be checked, and it should be placed according to that. We need to work on that further. Identify the course of action. Course of action means how we will lead, who will going to give the care, and where the area will be there, whether the patient will be in a general ward or a special ward or an isolation room. That has to be done. Then choose the action. Choose the action, whatever we had planned from the starting, everything that has to be among the many options. We need to choose one thing, and then we have to take the action. That single thing has to be taken, or like care has to be started for the patient. And the re-evaluation, like after completion of the everything, we need to work, we need to re-evaluate from the starting till the end, what whether everything has been going according to the plan, according to the stuff, and each while each step we are maintaining our standard and ethics or not. Next, we'll see about the PDCA cycle. PDCA cycle is a plan, do, check, and act. This is the four things. First, we need to plan what plan we had been made. We need to work, like we need to do or implement. We need to do work, implement on that plan, and again we have to check. whether what we have been planned we are doing that and we are in a flow or not, whether we are reaching towards our goal or not, that has to be checked and need to be asked. Ask means it is like a feedback. If we are after checking we are feeling like we are deviating from our standards and ethics, then again we need to work on that, again we need to plan, again we need to do like implement, and then again we have to, for example, planning is like for a patient coming with a fever. So I had been planned, first I will give some fluids, like more fluid diet to the patient, then I'll maintain the temperature of the room and well ventilated room, and I will give the patient sponge bathing or tepid sponging. These are plans I have been made. But while implementation, what I had been given, I have been given paracetamol. So again we have to check whether we are reaching our standard or not, whether we did not given any basic care but we reaching toward the medications, it will come as a last option. So on that we need to again work on it, like act on it, how it has to be again go, that is known as a PDA cycle, PDCA cycle. This is the same time how with the time the quality will be improved, like same thing is there, our standards are there, act, plan, do, act, check and act, that is PDCA. Consolidation through the standardization means like it is a continuous process. Till the time patient stay will be there, we need to work on that thing only what according to their needs, and as the time will enhance, if we are working on it properly, the quality of the patient care will be enhanced. So this will model will be working on the quality improvement specifically. Factor affecting the quality assurance in nursing care, like quality improvement is defined as an approach to the continuous study and improvement of the process of providing healthcare services to meet the needs of the clients and the others. Joint Commission and Accreditation of the Healthcare Organization. According to that, quality improvement is one of the most important thing, because assurity come with improvement only. If we'll once we will feel yes we are providing a good quality of care, but if we'll stop working on that, working improvement, because we need to make a better a best one. So we need to work continuously on that. If any skill is there, we need to make more skillful our staff or the nurses. Next one is principle. It required continuously quality improvement, knowledge of the customer expectation needs, process of customer supplier relationship, belief in people, statistical analysis, cost of poor quality. Like we should have a proper data, not only providing a quality of care, it should be a planning, then how we are providing, whether we are patient are believing on us or not, patient are believing in this hospital or not. Like some hospital you will say no, you will see very less patients will be there, very less OPDs will be there, because patient won't be having a much belief on that institution or hospital. If a patient will fix the belief while with the quality of care, and then patient will have the fixed belief, then the patient can come on the regular basis to that hospital. Next, condition in working environments, employees improvement and environmental that support taking risk, work, data collection, analysis skill, group interaction skill, structure and management to enable the improvement, tools to facilitate the improvement. Conditions, like in a which condition a person is working. If I am working anywhere, I need to get a like confidence towards that place. Safety and security has to be there, and there should be a freedom for me to work as I wanted to do. Like I should can also involve in the discussion, I can also give my point of view. So this thing has to be there in a working environment. Next component of quality improvement program are establish responsible and accountability. Like responsibility, what work I had been allotted with, I am accountable for that, I am answerable for that. Define scope of services for the clinical area, define key aspect of services for the clinical area, develop quality indicators to monitor the outcomes and appropriate of care delivered, establish threshold for the evaluation of indicators, collect and analyze data from the monitoring activity. So these are the component has to be there in a quality assurance program or quality improvement program. Evaluate result of monitoring activity to determine the need of change in the practice, then resolve the problems through the development of action plan, reevaluate to determine if any plan was successful, communication quality improvement results to the organization, like whatever is being happening, that all the team should be know, our authorities should be know, our organization should be know, and there will be a systematic and stepwise step process should be there. Total quality management, it focuses the production and the services that the environment must be customer responsive. It identifies and do the right things the right way the first time and the prevent the problem for the public and the receivers. In this, customer need and experience with the end product are constantly evaluated. Like in this process, the feedback of the patient or our consumers is very necessary. On that basis only we can improve in our quality of care what we are providing. Standard, standard is a established rule as a basic. Standard is something which cannot be flexible. Okay, like some fixed standards are there and we need to work on that, and our main goal will be to reach our standards. Classification of nursing care standards. First is structure standard. Structure standard is all about the facilities, the equipment, the infrastructure, the human resource. This is structure standard. Second is process standard, like the level of performance, how whether the staff is skillful or not, whether they do have the academic knowledge or not, they do have the qualification or not. It will be working on that. Next is outcome standard. And outcome standard measures the changes in the patient health status. If I am providing care for patient with a fever, so after the care, the fever has to be reduced at least to the some extent. Not patient should not be free from the fever, but the fever has to be decreased from that level. So outcome has to be evaluated on the patient when we need. There should be a improvement in the health status of the patient. Next, we'll see about the role of a nurse. Role of a nurse to participate in the quality improvement team, properly services and the check whether the patient is receiving the proper care or not. As a nurse, our most important thing is there. We need to provide care as we are being studied for that. So there should be a scientific background or rationale has to be there, and we should involve in the each activity, whether it is a teamwork, whether it is a discussion, whether it is any decision making, because we the nurses are the one who are more time as compared to the any other professional with the patients. So we are more aware about how what our patients wanted and what are the need of our patients. Periodic and continuous appraisal and evaluation of healthcare situation of the patient. Participating in the research work, like as a nurse, we can also do the research study as we are more close to our patients. We are more aware about what they are struggling with or dealing with. And the other things, there should be a appraisal. Like we can also do for the patient appraisal, as well as we can also receive the appraisals from the team who are being evaluating us. Next, evaluation of quality assurance model for the public health nurses. Project was conducted for 1 year period. The project was based on NAA model for a quality assurance and uh, assess the standard for an overall quality assurance program. So this was an research project which was conducted 1 year for 1 year of a duration, and it was based on the ANA model, American Nurses Association model, for assessing the quality, and the purpose of the study to analyze the baseline outcome criteria for a quality assurance program and to implement an interface evaluation method and public health nursing services within the uh, health institutions or the hospitals. Its main purpose was to assess what care is being provided, with that what is the outcome, whether the standard is being enhancing or not. Identify the amount and kind of quality services provided and the strength and barriers, like advantages and disadvantages, what places we have to work and what area improvement is needed. Some study findings are outcome criteria standards are being met in a high percentage of instances, ranging from the 60 to 70 percentile, which is considered an outstanding result. Patient satisfaction survey indicated the extremely high satisfaction with the public health nursing services, ranging from 95 to 99 percentile. Peer review and utilization review standard also showed a very high positive percentile ranking. So this was the result of that study. Like quality assurance, one study had been conducted So they had been found a result in a percentile basis. In that study, the theory application was from the Florence Nightingale environmental theory. So I'll tell basically the Florence Nightingale environmental theory, somewhere it will be also called as environmental theory. In environmental theory, the Florence Nightingale had been told what is human body is being affected from the thing which is present in our environment. It will affect also and it will improve also, like sunlight is there, food is there, water is there, our climate is there. So these are things affecting the human being also, and these are being the reason for the well-being of the human being. So this theory is on that theory only they had been did the research, like light, food, noise, cleanliness, bedding, house, emotion, health of house, variety, housing, air. These are the component of the environmental theory. So this model application structure is their outcome structure. What is our planning? What things we are going to do? What population is there? And this process, the like implementation and the outcome as a result. What we had been got as a result. What are our findings? So system, for example, a diarrhea control program. We are working on that, and the structure is trained community workers, ORS packets, accessible health centers, and process is educating to the mothers, rehydration therapy, diagnostic studies. Means one study had been done on children's with the we need to control the like diarrhea control program has to conduct in a community area. Then we train the nurses and given the oral sachet of those ORS packets, and they should be accessible for as a health centers, and process what they have to do, they have to educate the mothers for because children cannot take ORS by their own. So we need to educate the mother as a health education. Then we need to tell about the importance of rehydration therapy, and home also how can they make the ORS solution, and some diagnostic studies. Then outcome, number of children treated, number of complications across, number of deaths due to the diarrhea. So this will be the result will be collected. See how they had been taken, whether they had been taught, so there will be improvement in the knowledge level or not. So what are the how many cases were there diarrhea, how many deaths was there because of diarrhea. So this was the outcome from this study. So last this theory application, it is having input, process and output. So in input, like a structure, we can see the participant is a provider, like a healthcare providers, the patient or a family, those who are customers and receiving the care, and the system like resource, workload, environmental of the organization. That was our input. In a process like relationship center, independent relationship, patient, family, nurse, plus collaborative relationship with the healthcare teams, professional encounters like the health centers allowed them to go there, and they were like they were helping us to visit the villages because they are more aware about the population in the village. And our outcome should be like a terminal outcome like provider, patient satisfaction, personal growth. As a person, if I'm going to provide health education, I will also get some knowledge about that. I will also increase my therapeutic communication skills, and I will be satisfied after providing this or knowledge to the patient. And as a receiver or a customer, quality of life, safety, satisfaction, means they will get some knowledge, they will be aware about those problems or basic conditions, and they will be satisfied as the treatment will be very basic. They will be know for this what we have to do. So this was a outcome. So here it was all about the quality assurance for in medicine. So as a nurse, as a healthcare profession, as a medical person, we need to first work on our patient, because if we are studying and we are not treating the patient, there is a no need of our studying. So in this session, I hope this was a knowledgeable and session for you all, for all the batches of nursing and paramedical as well, in a working in a hospital or being a student or being a teacher. Then in the quality assurance model, we have been seen about like definitions and nursing audits also we have been seen, then approaches we had been seen, objectives, principles, and we have been also seen the theory application. As a master student, we need to do the theory application in writing each answers or presenting anything. We should have a knowledge on that. So it was all about the today's class. Hope it was helpful. So stay tuned with us with our live channel and live YouTube channel, rgcsk.edu. Thank you and have a good day.